Bismillah ar-Rahman ar-Rahim. Gene therapy and the lung diseases. Right now, therapies directed towards these conditions can only alleviate the symptoms, which are manifestations of the defective genes. These gene therapies seek treatments that act at the level of the gene itself. A number of vehicles have been developed to deliver corrective genes into the cells. Some are more effective than others, but none is yet exactly right. Gene therapy, in its central principles, is the addition of gene function through gene transfer. For a disease like cystic fibrosis, this means inserting a functional copy of cystic fibrosis transmembrane regulator gene, CFTR gene, into airway epithelial cells that are genetically defective at this locus. However, there are some situations where even if this were accomplished, the disease phenotype would persist. An example of this is alpha 1 antitrypsin deficiency. Although lung gene delivery of the alpha 1 antitrypsin gene might prevent the progression of obstructive lung disease, it would do nothing to prevent the fatal hepatic failure affecting up to 25% of individuals. This liver failure is a result of misfolded protein in the Golgi apparatus and in endoplasmic reticulum of the hepatocytes. An alternative strategy being investigated is gene correction therapy. The theory behind this strategy is to insert a molecular mechanism into cells that targets the abnormal DNA sequences in the chromosome and corrects the mistake. It remains to be under trials whether this approach can be used to correct genetic error in patients with alpha 1 antitrypsin deficiency.